very excited to tell the story about our study. As we know, anaplastic thyroid cancer is a rare and aggressive type of thyroid malignancy with very poor outcomes and prognosis. The problem is the rare of this entity and the poor functional status the patients with anaplastic thyroid cancer make it very difficult to conduct clinical trials. And there is a lack of large and controlled trials that evaluate treatment and evaluate the benefit of multimodal and combined therapies. So we use National Cancer Database to include patients, adult patients who were diagnosed with anaplastic thyroid cancer between 2004 and 2018. After excluding patients with unknown number of treatment modalities and patients with comorbidity Charles-Fondius score of 3 or more, we split the cohort into 3 groups. And that's according to the number of treatment modalities they received. In group 1, patients either received 1 treatment modality or did not receive any treatment. In group 2, they received bimodal therapy. And group 3, patients received trimodal therapy. The treatment modalities that we included are surgery, radiation, and chemotherapy. Then we evaluated the overall survival between the 3 groups. We studied the overall survival using Kaplan-Meier estimates and a multivariate Cox regression analysis to evaluate factors associated with overall survival. We had 3,460 patients with anaplastic thyroid cancer. 42% of them were in group 1, 32% of them were in group 2, and 26% in group 3. We found that patients in group 3 who received the trimodal intensive therapy had significantly improvement in overall survival compared to patients in group 1 and group 2. The median overall survival was 9.1 months for group 3, whereas group 1, the median overall survival for them was 1.7 months and 4.9 months for group 2. The same trend we found when we did subgroup analyses according or based on the metastatic status. Group 3 patients who received the intensive trimodal therapy still has significant improvement in overall survival compared to patients who received less intense therapy in both metastatic and non-metastatic disease. In multivariate analysis, we found that less intense therapy was associated with poor or less or worse overall survival compared to patients who received intensive trimodal therapy. So in conclusion, patients with anaplastic thyroid cancer who received intensive trimodal therapy had improvement and significant improvement in overall survival compared to less intense therapy. This observation and the improvement of overall survival was seen in both metastatic and non-metastatic disease. So our study in conclusion raised the attention and showing the critical role of intensive combined therapy in this aggressive malignancy.